In this video, I'm going to talk about postoperative day number 3 to postoperative day number 5 after a Shouldice hernia operation. So hopefully you've watched my videos of what to expect on the day of day number 1 and day number 2 after surgery. Day number 3 and 5 are very similar to one another, and so I kind of lump them together. Typically, once you've gotten to postoperative day number 3, that means you have had an overnight sleep after surgery to get you to postoperative day number 1. You've had another sleep at home to get to day 2, and now you've had a full third night of sleep at home, and now you're 3 full days, so 72 hours after surgery. Between this day and the 5th day after surgery, you're going to see some sort of plateau and a beginning of recovery. Most people by the 5th day start feeling like they've turned the corner. The 3rd day is often still painful. It's very similar to the 2nd day. You're still needing to take Tylenol and Motrin around the clock. You're icing the area for discomfort. You're no longer taking pain medication that's been prescribed if you're the 1 in 10 patients that's taken prescription pain medication. You are feeling that you can get around the house a little bit, but it's more painful than you thought. You feel like you should be getting better faster, but because we did a no mesh repair and we really tightened your natural tissues together, they're swollen, they're uncomfortable, and it's still hard to get in and out of bed, walk around and do the activity of daily living that you expected to. Day 3 to 5 after a Shouldice repair are sometimes the more challenging days psychologically, because you feel like surgeries happened so long ago that you should be feeling better and you're not. You're noticing more and more swelling in your groin. You're also noticing more and more bruising. It can be black, blue, purple, green, yellow. It's traveling down to your thigh or to your genital area. It can be scary looking. And you might even feeling a little frustrated of why aren't you getting better faster? And the reality is, this is normal recovery after a Shouldice repair. Because we were able to avoid mesh, because we were able to use your own natural tissues, your natural tissues are healing. Healing means swelling. Swelling means compressing blood vessels, nerves, skin, and stretching. All of that causes pain and discomfort. And that pain and discomfort typically lasts 5 days after surgery. Almost everyone starts turning the corner on that 5th day after surgery. Some of you might be turning the corner earlier. Some people might turn the corner a little bit later. But I would say probably 80 to 90% of our patients have a plateau for day 3, 4, and day 5. The pain and discomfort starts getting better, and you start moving a little bit more freely. You feel like you might be able to drive. You might be able to participate in daily activities. You might even be able to go out. We do expect you to start walking outdoors by postoperative day 3. Both the fresh air and sort of the endless road, whether it's a sidewalk, whether it's a road, we want you to get outside those 3 days. Really, we want you to restrict your activity. You're not doing any heavy lifting, you're not exercising, and if you do go for a walk, it should be at a leisurely pace. It should not be for exercise. It's really just to get the joints moving, to blood flow, to get your lymphatic system to drain properly, so that you are accelerating your own healing. Please know that if you overdo it, you're going to get increase in pain. You're going to get an increase in swelling. Those go hand in hand, and that is just your body's feedback to your brain to slow it down a little bit. So it's normal to overdo it if you feel really good and then suffer a little bit of a setback, not feel quite as good as you did, even have a little bit more pain. The only thing that could be of concern in this day is that if all of a sudden you feel excruciating pain, that's not normal, especially if it's unrelated to activity. So if you have significantly more pain because you're active, and then when you lie down, that pain subsides, that's normal. You just overdid it. If you have sudden pain anywhere in your body 3 days after surgery that starts out of the blue and is there when you're still, that should give us a phone call. We get one of those phone calls every year or two. It's usually something benign, but can be an indicator of a problem. And so if you think something is not right, you've watched these videos, you feel like your recovery isn't exactly as portrayed in this range of outcomes, give us a call. These videos are not intended to replace the clinical judgment of your surgeon. So having said that, the only thing I'll add to this day is that if you haven't gotten much black and blue by the 5th day, you might not. There are certain people who just heal in a way that doesn't allow for a lot of bruising, and that's okay. For patients who are on anticoagulation and may have been left on anticoagulation after surgery, sometimes you'll bruise a lot and sometimes you might not. And both of those are okay. We really go by how you're feeling and how you're recovering. But generally by the 5th day, we expect you to start feeling better.